Does egg sharing in IVF affect your chance of having a baby? So, this study looked at a very important question in IVF. If you share your eggs, which is sometimes done with another woman during fertility treatment, does it make it less likely that either you or the other person will have a baby? This practice is known as egg sharing, in which a woman undergoing IVF donates some of these eggs to another woman who can't use her own, usually in return for some help. And some clinics would do that. This is arrangement is vital in UK and in some countries because there are just enough egg donors for everyone who needs it. Now, researchers studied over 5,300 IVF cycles in a London clinic, dividing participants into four groups. These included women who donated eggs through egg sharing, women who had standard IVF, women who received shared eggs, and women who received all the eggs from the donor. The groups were matched for age and other important factors to keep the comparison fair. The results were reassuring. The chances of having a baby were nearly identical for women who shared eggs and those who kept all the eggs for themselves. Likewise, recipients of shared eggs did just as well as those who got all the donor eggs, while egg sharers and their recipients had fewer eggs and embryos available each round. Their chances, each embryo transfer were not harmed. But remember that when you share eggs, each of you all is going to get a lower number of eggs. And as long as that is reasonable, up to five or six, it still gives you the same chance of getting a day five embryo. Now, the only difference found was that because there are fewer eggs and embryos to work, a smaller percentage of donors and recipients may need more IVF cycles to achieve the live birth. Thus, the overall cumulative chance of having a baby was slightly lower, but still very good, between 52% compared to 56%. Importantly, there was no increase in complication rate and the risk of overstimulation. So, to some aspect, this is quite a good study because it does give you an idea about the egg sharing program, and it also tells you whether you can, by sharing eggs, even though you're getting a lesser number of eggs, the chance of pregnancy per embryo transfer, at least for the first one or two, remains very much the same.